Thanks to advancements in imaging and more thorough screening, breast cancer is caught more often at earlier stages. Early detection and pre-surgical chemotherapy mean that tumours are typically smaller, less defined, and harder to locate. Today, 50% of all breast tumours are impalpable at diagnosis, making it difficult for them to be located for surgical removal by touch alone. For decades, surgeons have predominantly used wires with barbed ends to mark the lesion intended for removal in breast conservation surgery. But wire-guided surgeries have well-known challenges that often lead to surgical delays and cancellations, unsuccessful procedures, and added stress for patients. As an alternative, some hospitals use radioactive seeds to mark the lesion for removal, but the complex regulations required for handling radioactive materials makes this solution an option for very few institutions. With 1 million new cases of breast cancer every year, isn't it time that radiologists and surgeons had a simple tool they can use to mark lesions confidently and precisely? Introducing the LOCalizer, an easy and more accurate way to guide breast surgeries. Instead of using wires or radioactivity, the LOCalizer marks the lesion with a miniature radio frequency tag that is tracked with a mobile handheld reader. Each tag is a unique ID number and is encased in a sheath protecting it from migration and damage. The tag is implanted with a needle like any other marker using ultrasound or X-ray guidance. The tags are designed to be implanted into the breast up to 30 days prior to surgery, avoiding multiple procedures on the day of surgery. The LOCalizer has 2 detection probes. The first probe is integrated into the reader itself and can be used on the skin's surface in both the sterile surgical field and non-sterile environments. This probe can be used by the radiologist to confirm the position of the tag and by the surgeon to plan the surgical path. The second is a pencil-sized, single-use sterile surgical probe that guides you towards the tag during the operation. As the probe gets closer to the tag, the handheld reader emits an audio tone and displays the distance from the tag in millimeters without any lag or delay. The tag's unique ID number is also displayed, ensuring that this is the intended marked location. After surgery, either probe can be used to confirm that the intended tag was removed with the tissue. The LOCalizer is an easier to use, more accurate solution that gives you the precision you need without the drawbacks of other localization techniques. No localization wires, no radioactivity, no scheduling conflicts before surgery, and no interference with other OR equipment. And most importantly, it improves the standard of patient care by making an already stressful experience a little bit easier for you and your patients.